think you're my next patient for the day. I heard that you were having some issues with your cranial nerves from Dr. Blab. Is that correct? Okay, well, let me just put on some gloves here real quick. How long have you been having issues with everything discussed in your doctor's appointment? Okay. I see. So, it sounds like it really hasn't been going on that long. Does that sound correct? Okay. I'm just gonna get close to you here real quick and just kind of look at a few things. Sometimes, if I can notice something with the eyes or the ears, we can kind of rule some things out. But I don't see anything just out the gate. How long have you been a subject or a patient? How long has that been going on? How long have you been seen by doctors? Oh, wow. Almost 4 years now. Well, that's quite a while that you have been seen by people. I hope everything is going okay, and I hope that, all of your results over these years, I hope they have been very consistent. Yeah, well, let's get into it. We'll just start here with an easy little vision test. So how this is going to work is I'm going to hold up 2 fingers, and I just need you to tell me which finger is wiggling. Okay. Now, the fingers, they might move around your field of vision, but they will always pause, and there will always be one wiggling. Okay. So let's begin. Okay. So tell me which one's wiggling. Very good. And tell me which one's wiggling. Very good. And which one's wiggling? Very good. And which one's wiggling? Very good. And which one's wiggling here? Very good. And which one's wiggling? Very good. And which one's wiggling? Very good. And which one's wiggling? Gotcha. Okay, that looked fine and normal. Let me look up something real quickly. Alright, so just to continue that field of vision test, I'm going to hold my fingers back up, and I need you to just tell me when they completely exit your field of vision, okay? So I have 2 fingers here, and very good. Very good. Very good. Very good. Very good. Very good. Okay. Moving on here. I have this. I have a few bottles of scented oils. Now, what I'm going to do is I'm going to test a few of these oils. I'm going to open them up and put the dropper under your nose, and I need you to just tell me what smell you smell. I will let you know that these are not tricky smells. They're very common things that most people should know, okay? So we'll just begin here with the first one. And can you tell me what you smell there? Cinnamon. Very good. Let me get another one here. Okay, here's number 2. And just tell me what you smell here. Lavender. Very good. Okay, and let me get another one here. Okay. And last one. Can you tell me what you smell? Spearmint. Okay. Okay. Let's move on to the eye chart here. I'm just going to test your field of vision and your depth perception, okay? So I'm just going to run through all of these here and just tell me what letter you see as we move down the chart, okay? Can you tell me what this top letter is right here? E, very good. And this one, F. What about this one right here? P. How about this line? What is this? T. And how about this one? O. C. Very good. Let's keep going. C. H. A. N. N. E. L. Very good. Now, this is kind of the line right here where most people usually start having a hard time reading. So if you can, let's just move down to these harder lines here, okay? Can you read this? R, very good. And what's this one? C, and how about this? B, and D, very good. Okay, now what is this one right here? No, it's an E. What about this one? C, F. No, that's a P. What about this? That's a D. And then can you make out any of the letters down here on the hardest line? No? Okay, it's not a problem. People typically have a very difficult time reading that bottom line, so I don't want you to fret, but I do want to do some more eye tests on you, okay? So, I have two lights here. Now, I'm going to turn these on, and you're going to have two different colors. You're going to have a red and a blue light, okay? Now, I'm going to just turn these on right now, okay? And I'm just going to ask you a variety of questions with these lights, okay? So, like right here, like which light is closest to you? Very good. And which light is closest to you here? Very good. And let's do it once more. Which light is closest to you? Very good. And which light is closest to you here? Very good. Now, can you tell me when the red light leaves your field of vision, okay? Very good. Very good. Very good. Very good. And can you tell me when the blue light leaves your field of vision now, okay? Very good. Very good. Very good. Okay, now, with this next test, I need you to keep your head still. And I need you to just focus on the red light. I need you to absolutely ignore the blue light. Just focus on the red light, okay? Okay. Wherever the red light goes, you need to follow with your eyes and absolutely do not look at the blue light. Just look at the red light. We really need to make sure that your results are consistent. Very good. Very good. Very good. Very good. Okay, great. Okay, for our last test, I'm going to have to get a little bit closer to you. I'm just going to whisper some numbers in your left ear and some numbers in your right ear. I will do them in sets of 3. And I need you to just repeat back to me the numbers, okay? Okay, great. So again, I do have to get a little bit closer here, and we'll start on this side here, and I need you to just repeat back the numbers 3, 2, and 8. Very good. Let's go to the other side here. So on this side, I need you to repeat back to me the numbers 9, 1, 0. Okay, great. And on this side, I need you to repeat back the numbers 22, 4, 61. Okay, and one more over here. 73, 26, 19. Very good. Let's do the same test, but instead of numbers, I'm going to just do some words, okay? Okay, so, yep, you got it. Just repeat back to me whatever words I whisper to you, okay? Okay, let's go to this side. Microchip. Okay, very good. Subject. Okay, very good. Exodus. Okay, great. And just a few more here, okay? Trouble. Okay, and the last one here. Programmed. Okay, great. Well, it looks like most of your results have been ruled out with the cranial nerve. I'm curious, how often do you sleep a night, or have you ever had troubles with sleeping issues? Oh, okay. Well, the reason I ask is sometimes the issues with our patients, patients, they can get conflated. So sometimes the results from a cranial nerve or the issues from a cranial nerve exam might get convoluted with a sleep study. There's kind of overlapping issues there. So with the exam that we did today and the results that we received, I think your cranial nerves are okay, but you might want to get a sleep examination done. Yeah, I can help you book that. I can help you referral out if you need that. Okay, great. Well, I'll probably be seeing you soon. Thanks for your time today.